Hey everyone, and welcome. If you or someone you know is living with HIV, you know there are a ton of questions. And probably the biggest one is about treatment. So today, we're going to demystify antiretroviral therapy, or ART, and really break down those critical first steps on the path to managing your health. You know, to really get a feel for just how monumental ART is, this quote just says it all. A rescue boat. It perfectly captures the sheer hope it brought. Because before these treatments, let's be honest, an HIV diagnosis was a completely different story. The big turnaround really kicked off in 1995 with something called highly active antiretroviral therapy, or HAART. This triple therapy approach was the game changer. I mean, it completely flipped the script. It took HIV from a disease with so little hope and turned it into a chronic, manageable condition, something you could live with, kind of like diabetes. It was, and it still is, an absolute lifesaver.
All right, so for anyone who's newly diagnosed, this is almost always the first thing on your mind, that big, pressing question, when do I start? It's a huge decision, so let's get some real clarity on it.
For years, there was a lot of debate about this, about the perfect time to start ART. But thankfully, the science we have today is crystal clear. So, what's the answer? It's simple. Start treatment as soon as you possibly can. The medical consensus all around the world is that starting ART right after you're diagnosed gives you the best shot at long-term health. And this is true no matter what your CD4 count is, and that's just a way of measuring how strong your immune system is at that moment. And what's really powerful is just how simple the official guidelines are now. The recommendation is exactly the same for everybody. I mean, just take a look at this. It doesn't matter if we're talking about an adult, a teenager, or even a young child. The advice is to start lifelong ART right away. This clear, unified message gets rid of all the old guesswork and just focuses on one thing: protecting your immune system from day one. Okay, but starting treatment isn't as simple as just grabbing a prescription and you're good to go. ART is a lifelong commitment, and being truly prepared is the real key to success. And that's where pre-ART counseling comes in. Think of it as the foundation for everything that's about to follow. This checklist right here, this is basically the roadmap for that crucial conversation you need to have with your healthcare provider. It's about really getting your head around the fact that this is for life. It's about understanding why taking your pills perfectly 100% of the time is so important. And yeah, it's about talking through side effects, family planning, and even building your support system, like finding a treatment buddy you can lean on. It's all about creating a plan that actually works for your life.
So, once you're prepared, what's next? Well, now we got to talk about the actual medications you'll be taking. The word regimen can sound a little clinical, a little intimidating, but trust me, it's more straightforward than you think.
Remember HAART, that triple therapy we mentioned? Well, that's the core strategy. By using a combo of different drugs, the therapy attacks the virus at different points in its life cycle. Think of it like a coordinated attack from multiple angles. This is what makes it so darn effective at shutting the virus down and, maybe most importantly, stopping it from getting stronger and resisting the medication.
So how are these drug combinations actually chosen? Well, there are basically two main ways to go. On the one hand, you've got an individualized plan, which is tailored specifically to you. But in many public health systems, they use a standardized plan. Now, this one-size-fits-all approach might sound less personal, but it's an absolute game changer for public health. Why? Because it simplifies everything. Training healthcare workers, monitoring patients, managing the drug supply. It makes it possible to treat millions of people effectively. All right, this next part is maybe the most important piece of the puzzle. We're getting to the heart of what it means to live with ART. Starting is that first big step, but this journey is a marathon, not a sprint. And lifelong success really boils down to two things: adherence and awareness.
Let's talk about one number. One single number that is absolutely crucial for success: 95%. That is the minimum level of adherence you need for the therapy to work properly. And here's why it's so strict. HIV copies itself incredibly fast, and it makes mistakes when it does. If you miss doses, you're giving the virus a little window of opportunity to make new copies that might be resistant to your drugs. Hitting that 95% target, or even better, 100%, keeps the virus locked down and stops those resistant strains from ever getting a foothold.
Now, this plan here for helping a child with adherence is a perfect example because, honestly, these principles are universal for anyone on ART. It all comes down to the same things: education, having a dedicated support person, planning ahead for those times your routine gets thrown off, like on weekends, and just staying motivated for the long haul.
That right there is what a successful support system really looks like. So, beyond just taking your pills on time, a huge part of managing ART for life is being aware of what else is going into your body. And this is where we have to talk about drug interactions. Your antiretrovirals, your ARVs, can interact with a lot of other things. This includes other prescription drugs, like for TB, which is a common co-infection, but it also includes stuff you can buy at the pharmacy, and even herbal remedies. So the single most important rule is this: you have to be totally 100% open with your doctor. Tell them about everything you are taking, no matter how small or insignificant it seems. Seriously, this isn't a minor detail. Your safety and the success of your entire treatment depend on it. So as we start to wrap up here, I want to try and reframe how we think about this lifelong commitment. It doesn't have to be a burden. In fact, it can be a new and really powerful relationship that you're building with your own health and your own future. I just love this quote because it changes the whole vibe. It says you should have a lively relationship with your medicines. What does that mean? It means you're not just passively swallowing pills. You know their names, you know what they do, you know how they work in your body. They become your partners on this journey. So, I'll leave you with this to think about. What does a healthy, empowered relationship with your treatment look like for you? How can you make it a seamless, positive part of your everyday life? Because answering that question, that's the real key to not just surviving, but truly thriving. Thanks for tuning in.